Curiosity, and today I wanted to discuss some different nursing specialties. So whether you're a brand new nurse or a nurse looking to change your specialty or just curious on where can you work as a nurse, then this video is for you. So I'm going to divide up these specialties into 5 different categories listed here. So the first one I want to talk about is women's health and pediatrics. And then just as a reminder, this is for registered nurses. So whether you have your associate's or your bachelor's degree, this will be for any registered nurse in that specialty. So whether you just passed your NCLEX and now you're ready to start your career, or you have been working for a while and you're burnt out and want to try something different, then like I said, this video is for any registered nurse that might be in one of those categories. And disclaimer, I'm not going to discuss pay in these videos because it honestly just depends on your location, the hospital system that you work for, and your level of experience. But I can honestly say for the most part, there's not going to be a big range in pay difference, especially if you are starting off as a brand new nurse. So on the first section, we're going to talk about women's health and pediatric specialties. So this tends to be one of the most popular specialties a lot of people want to get into when becoming registered nurses. There's different specialties that you can get into. A lot of people tend to think of like Nicu and labor and delivery, but there are other specialties that fall up under that category. So stay tuned and let's get started. A high-risk OB nurse takes care of pregnant women who are having complications during their pregnancy, causing them to be admitted into the hospital. These expecting moms are dealing with complications such as preeclampsia, premature rupture of membranes, incompetent cervix, and things that may require an extended amount of time of bed rest. Fetal monitoring and also monitoring the mom's vital signs is very important in this specialty until it's time for them to deliver. A labor and delivery nurse takes care of the mother and infant before and during birth. As a labor and delivery nurse, you'll be monitoring the vital signs of the mother and the baby, monitoring the mother's pain, prioritizing safety, being an advocate for the mother, and providing emotional support for the mom and her family. You can work as a labor and delivery nurse in the hospital or in a birthing center. As a labor and delivery nurse, you will assist during the birthing process of a vaginal delivery or in a C-section. If you're able to handle stress, enjoy working in a fast-paced environment, and are empathetic, then a labor and delivery nurse would be a good choice for you. A postpartum nurse cares for the mother after delivery. Some hospitals do couplet care where you also take care of the baby. As a postpartum nurse, your duties typically will be to monitor for postpartum bleeding, providing emotional support, assisting mom with breastfeeding, wound care, managing pain, and monitoring the vitals. Teaching, providing emotional support, and reassurance are big roles as a postpartum nurse. As a newborn nursery nurse, you take care of the newborn immediately after delivery until they are discharged from the hospital. Most newborns stay in the room with the mom and the family instead of being taken into the actual nursery. As previously mentioned, many hospitals do couplet care. So if your hospital does not do couplet care, you will only be taking care of the newborn. But if you do couplet care, you will also take care of the mother. As a newborn nursery nurse, you will be assessing your baby, assisting with feeding, checking vitals and bilirubin levels, and helping mom with breastfeeding. If you enjoy taking care of newborn babies and you're caring, a newborn nursery nurse would be perfect for you. A neonatal nurse cares for premature and critically ill newborns in the NICU. Newborns with birth defects, jaundice, born underweight, unstable glucose levels, or complications during delivery are typically admitted into the NICU. Their stay can range from a few days, a few weeks, or even a few months. Neonatal ICUs range from levels 2 through 4, where 2 you'll be taking care of more of the feeder grower population, which are babies that just need to gain weight, and levels 3 and 4 are more of the critically ill patients. Continuity of care is big in the NICU, so you'll tend to keep your same patients. Great assessment skills and ability to provide emotional support are needed in the NICU. As a lactation consultant nurse, you will help mothers breastfeed their babies while assessing the latch and helping them overcome any difficulties they may experience while breastfeeding. Many newborn nursery and NICU nurses become certified to become lactation consultants. If you enjoy teaching, you're passionate, independent, empathetic, patient, and have great communication skills, lactation nursing would be great for you. As a pediatric nurse, you will be taking care of kids ranging from the age of infancy to up to ages 18 to 21. Unlike the previously discussed specialties, as a pediatric nurse, you can work in the hospital or in a doctor's office or clinic. There are different specialties that you can work in as a pediatric nurse, and we will discuss more of those specialties in a different video. However, some of those specialties include oncology, cardiology, neurology, and so much more. As a pediatric nurse, your responsibilities include giving medications, managing IVs and lines, wound care, advocating for your patient, assessing developmental milestones, and giving vaccinations. As a pediatric nurse working in the hospital setting, you will tend to work 12-hour shifts, just like many of the other specialties we talked about. However, if you work in a clinical setting, you may only have to work 8-hour shifts. If you enjoy working with children, you're creative, you're patient, and you like to provide support, a pediatric nurse will be great for you. Thank you for watching this video about different nursing specialties you can work in as a registered nurse. I will definitely be dropping some more videos, so definitely check those out. And once again, thank you for watching.